It will look at issues around race and racism in publication. We will look at some of the issues around peer group. We're very fortunate to have Dr. Lamb from Lancaster University coming to talk about his research in a race personality disorder and the lack of Black peer representation in terms of peer support. We're going to have a slight break, and then we're going to talk about the training workshop, but we want to look about whether it can be improved so it really does address the racialized lived experience and encourages more people from that background to be involved in that. We're very fortunate today that we have a senior editor from the Lancet who will outline some of the recommendations they will make from the training we've done today. And there will be a workshop, hopefully next year, to encourage, promote, and train more people in this sphere. But let me just go into the next slide to outline why we're meeting today. We've got a great introduction from Professor Ashraf from Oxford University, who's told us about the fantastic relationship we've developed through something called the Whiteness and Race Equality Work over the last 7 years. And it really is an activist campaigning opportunity to promote real change and race equality in all parts of the mental health system, not just in terms of providing services, but in terms of academia and changing publication in terms of how they represent the lived experience. So if I just go to the next slide, I'm really got a big thank you for the group of people who were involved in the training. Some of them are here today, but what we did, you can just go back to the slide before, what we were really focused on, this big concern about race and racism in funding. Why is it going to specific academic institutions? Are people with lived experience from racialized communities really represented on those academic boards that make very important decisions and also publish very important articles about our lives? Just going to go to the next slide. So just going to outline what we do. The Whiteness and Race Equality Network was built on a foundation of an idea from Professor Forford, who's here today from Oxford University, in collaboration with Anna Beecroft, who is a professor of philosophy about mental health in Manchester University, and Simon Clark, who gives his apologies today. He's one of the co-founders. There are other partners who have been involved in this work over the last 7 years. And it says all we really wanted to do is raise the profile of survivors and practitioners to develop better quality research that really tackles the issues of race equality through this idea of co-production. And we will define co-production a bit more specifically later on in the presentation. But we want to be more specific about some of the concerns that are facing us in this space, really about a diagnosis. How can it become much more about a race perspective? And also, how do we actually address this wide polarization between whiteness and blackness in mental health work? But more importantly, the end thing is that how do we together work across these lines of race, profession, academia to be more reflective and to improve representation? Our website's available. You'll see a list, a very full, complex list of the work we've done over the last 7 years. So that's what we actually do as an organization. But let's talk about what today is all about in the next slide.